Hello, I'm Dr. Robert England with England Sports and Orthobiologics. If you're watching this video, you're preparing for a platelet-rich plasma treatment, or PRP. PRP is one of the most powerful ways we can use your body's natural healing system to treat conditions such as tendon injuries, ligament injuries, osteoarthritis, and other musculoskeletal conditions. But it's important to understand something right away. PRP does not work like an anti-inflammatory or a steroid injection. Instead of temporarily blocking pain, PRP works by stimulating your body's natural healing response so that the injured tissue can repair itself. Because of this, the health of your body and metabolic system plays a major role in how PRP works. The goal of this short video is to help you prepare your body and understand what to expect so we can achieve the best possible results. PRP is created by drawing a small amount of blood, anywhere from 60 to 120 milliliters of blood. We spin that blood, we concentrate the platelets, which contain powerful healing proteins called growth factors. These growth factors stimulate important biological processes such as collagen production, new blood vessel formation, stem cell recruitment, mitochondrial activation, increased cellular energy production, and tissue regeneration. PRP activates repair cells such as fibroblasts and tenocytes, which are responsible for rebuilding injured tissue. However, the quality of the platelets we obtain depends on the health of the person they come from. In other words, your biology influences your results. So an important concept in orthobiologic medicine is that the metabolic health affects tissue healing. Conditions such as diabetes, insulin resistance, metabolic syndrome, and chronic systemic inflammation can reduce the body's ability to repair tissue. Elevated blood sugar and insulin resistance can affect platelet function, collagen synthesis, mitochondrial activity, and inflammatory signaling. So this can reduce the effectiveness of biologic treatments. The good news is that many of these factors can be improved through nutrition, physical activity, sleep, weight management, and metabolic optimization. At England Sports and Orthobiologics, we focus on treating the entire system, not just the injured structure. Optimizing metabolic health creates a better environment for your body to heal. So, medications to avoid before PRP. PRP works by triggering a controlled healing response, and certain medications can interfere with that process. So please avoid anti-inflammatory medications for 7 to 10 days before your procedure, including medications such as ibuprofen, also known as Advil or Motrin, naproxen or Aleve, diclofenac, Mobic, carmeloxicam, indomethacin, and Celebrex. These medications block the inflammatory signaling pathways that PRP relies on to start healing. So if you need pain relief before the procedure, Tylenol or acetaminophen is generally acceptable. Okay, some supplements to pause. Some supplements can affect your platelet function as well, and they can increase your bleeding risk. We typically recommend stopping these 5 to 7 days before the procedure unless otherwise instructed. So supplements such as fish oil, turmeric, or curcumin, garlic supplements, ginkgo biloba, high-dose vitamin E, and resveratrol. If you're unsure about a supplement, please ask our team. Nutrition before your procedure. Tissue healing requires the right nutrients and building blocks. In the days leading up to your PRP treatment, we recommend focusing on whole foods, high-quality protein, healthy fats, fresh organic vegetables and fruits, and minimally processed foods and minimal sugar. We'd recommend this at all times, but this is to optimize your body. So protein intake is also particularly important because connective tissue repair requires amino acids. Those are the building blocks. So a good general target for many patients is approximately 0.7 to 1 gram protein per pound of body weight per day around the time of treatment. Again, we'd also recommend this at all times, but this is to really optimize you. Hydration. Hydration plays an important role in PRP processing. In the 24 hours before your procedure, drink plenty of water, avoid excessive alcohol, and consider electrolyte fluids. Being well hydrated improves the blood draw quantity and platelet concentration. Movement and circulation. So light physical activity helps improve circulation, metabolic health, and insulin sensitivity, all of which support healing. So activities such as walking, cycling, mobility exercises are helpful before your procedure. Avoid heavy activity that aggravates the injured area right before treatment. Okay, you've maybe heard about our MLS laser therapy. So in many cases, actually all cases, we combine PRP with MLS laser therapy to enhance healing. MLS stands for multi-wave locked system laser, which uses 2 synchronized wavelengths of light. It's the only machine to do that. These wavelengths stimulate cellular activity by increasing mitochondrial activation, increase ATP production, improving oxygen utilization, stimulating collagen production, so stimulates those fibroblasts, promotes new blood vessel formation, reduces edema and inflammation. Unlike many lasers, MLS is non-thermal, meaning it stimulates healing without overheating the tissue. It is non-thermal. Large clinical studies following thousands of patients have shown significant pain reduction, improved function, and very high patient satisfaction rates when combined with biologic treatments. So MLS laser therapy can help enhance cellular activation and accelerate tissue repair. What to expect after PRP? This is very important. So one of the most important things to understand is that PRP does not provide immediate pain relief. This is different from steroid injections. In fact, you may experience a little bit more pain, soreness, stiffness, temporary inflammation for several days after the injection. This is often a sign that the healing cascade has started. Healing from PRP takes time because the goal is actual tissue repair, not just temporary symptom relief. So in general, our expectations are gradual improvement over the first several weeks, approximately 50% improvement by around 6 to 8 weeks for many patients, and continued improvement over 3 months to 1 year. Many patients experience their best results several months after treatment as the tissue continues to remodel and strengthen. Rehabilitation, proper loading of the tissue, and metabolic health of all influence these outcomes. Day of your procedure. On the day of your PRP treatment, please eat a light, healthy meal, stay well hydrated, and wear comfortable clothing. When you arrive at our clinic, we focus on creating the best possible healing environment. Depending on the procedure, we may incorporate relaxation techniques, metabolic priming strategies, diagnostic ultrasound guidance, and rehab planning. All of this is designated to help optimize the healing response. Final thoughts. At England Sports and Orthobiologics, our philosophy is simple. We don't treat just an injury. We focus on optimizing the entire system that allows your body to heal. PRP works best when it is combined with metabolic health, proper nutrition, rehabilitation, and advanced technologies like MLS laser therapy. By preparing your body and understanding the healing timeline, you give yourself the best chance for a successful outcome. We look forward to helping you through your treatment and recovery. We will be there every step of the way. We will give you a private line where you can contact us with any questions.